Welcome to Aligned and Uncensored, where we talk real chiropractic, real practice, and the real issues shaping our profession. We're your hosts, Dr. Ken Markowski and Dr. Tiffany Newcastle. Today, we're joined by Dr. Andrew White. We're here to talk about the Mac's new partnership with AlignWell, information about Nomi Health, and the amazing new EMS pilot program, what it is, why it matters, and how it impacts chiropractors in Michigan and nationally. Andrew, I'm going to let you start with just tell us the passion behind how AlignWell came to be, because your story is incredible.
Yeah, so I grew up in Jackson, Michigan, actually not far from Ken.
Yeah,
Right.
hometown besties.
Yeah, home of the prison and the best donuts in Michigan.
Yeah.
And so my mom was a nurse at U of M. She, when I was young, actually gave up custody of me. She was going through a lot of mental health issues, and she had hurt her back when I was a kid, trying to help the patient. Her primary care doctor told her to get an MRI. They found a disc issue, referred her to an orthopedist who told her that the only resolution for that was surgical. She got surgery, had chronic pain still, did a second surgery, and then got put on Oxycontin, struggled with opiate addiction, and has been an addict on and off for almost my entire life. So it's why I wanted to go into healthcare, and originally I thought I was going to go into medicine, and it was pre-med, but then the consolidation that was happening in healthcare, I could just tell the way that things were moving. I was going to be able to practice the way I wanted. I was kind of naive at the time, thinking, oh, if I would just come in, I could be the voice of reason of, like how to approach pain differently. So then I ended up going to chiro school, and that was where I kind of started to unpack a lot of the trauma from my childhood and realized a lot of my passion was around the opiate crisis. So early on, I thought, because I hated the victim mindset, so I thought, well, what can I do? I'm not just going to complain. And I thought the best way would be to get involved with legislative things. So I got involved with SACA and SICA, and we go to D.C. and these leadership things, like trying to get involved with some of the political lobbying efforts. And it was a good experience, but I could just tell that I joke that it kind of felt like taking a Nerf gun to a nuclear arms race. Like there's just so much money and influence in Washington. So then I thought, okay, well, maybe the best way to tackle this is to go back to Michigan and find a very successful practice that is serving a lot of people, learn from them, and then try to help them grow, because then we can maybe make kind of a grassroots type impact. So then I went to Grand Rapids, ended up working with Eric Kowalski early in my career, and we had partnered together to open some more practices. That brought me to Holland. And back in 2017, opened a clinic there, and we were having a lot of success. Early on, we were seeing lots of people, and but I remember having lots of conversations with Eric when I was just feeling very frustrated, and it was just really weird, feeling, because I had prayed and dreamed of one day the vision's gonna be open a practice, be successful, and I was there.
Right.
And then I just felt empty, and I couldn't figure out why. And so I pray about it a lot, talk about it with my wife a lot. And would talk to Eric and say, we're doing amazing, by volume. We're one of the biggest, clinics in the state. And every week I meet patients like my mom who would come in and say things like, they've been on drugs, they'd had surgeries. And they would all say a similar sentiment, which was, I wish I would have met you sooner. And every time they would say that stuff, it would break my heart. I'm sure you guys have had that in your office where you take x-rays and you're looking at just discs that are almost bone on bone, and the what we can realistically do to, truly get them out of pain long term and improve function is just, there's limitations, and it's just hard to have those conversations with patients because you can't reverse time. And so I just started thinking about what else could we do? And I just started asking patients when they would say that, well, what stopped you? Why didn't you see me sooner? And they would usually say either time or money. And so I thought, okay, well, what are the biggest barriers to money and time? Or these biggest barriers, how do we remove them? And I thought, if we can help employers see that there's value in preventing these injuries, then I could make an argument for an investment to pay for chiropractic for their people as a benefit. And then initially I thought if we can just meet people at work, we just do this on site, then it gets rid of the money and time barrier, improve access, and go. So I hired a patient in 2019. who was working for Gentex in Zealand as a software engineer, and worked with him to create some software to try and tell that story, and then launch in 2020. And the goal was to see if I could get anyone to buy the product, like buy the idea. And so I got a couple of manufacturing companies in Grand Haven to start working with us. And so the original model was I would go to a business, I'd sell to them, and then we would find a local chiropractor, vet them, and then train them, subcontract them, and they would go on site to adjust employees. We would supply the table and everything they needed. They just need to show up and treat the people. The one thing the employees would have to go off site for were their initial exams and x-rays. So then we would just contract their clinic to do that, and then send the employees in, pay them, and then they would then do their adjustments on site. And that worked. Like it was work, and we would handle the management and the data side and the analytics. And we grew for a couple of years in the early, like 2021 and 2, took on more clients. And then I was running into these barriers at times where we would have employees who would want to get into the program, but they were single parents working 2 jobs, or they didn't have reliable transportation or other things. And so even though the appointment was free, getting that first step done was sometimes difficult to get to the clinic. Or we would schedule somebody and then they wouldn't show up, and the clinic's mad at me because they're like, dude, I've got these patients, you said they're going to be coming and only this many came. And I realized like this isn't really sustainable. So then I actually called the state of Michigan. I had the idea of like, well, maybe put an x-ray in something. Like, I don't know, like we can figure something out. And I called the state of Michigan to see if they would give me a license to put an x-ray in something. And they initially told me no. They're like, well, radiation and like they were.
Of course.
And I kept lobbying and pushing a bit and being persistent, and then they finally said yes. And then I called actually Great Lakes Imaging. Every time I see those guys, I always laugh because I called them and I was like, all right guys, so I have this idea. I want to put an x-ray in something. I think maybe Sprinter Van, or I don't know, and like, can you build it for me? And they're like, no. They're like, I mean, we'll install an x-ray, but like you got to build whatever you're looking to do, dude. And I was like, okay. So that was in 22-3. It was just throwing mud at the wall. This whole time I had this clinic that I was using as a bank to kind of fund the startup. And my wife had come in and she was helping to manage the clinic. I was still trying to work in the office a couple of days a week. And but again, I didn't go raise money. So then it was like, all right, I'll figure this out. So I hired a buddy. And I bought a toy hauler off Craigslist, which is a hilarious story where I've never bought a camper before. So I literally YouTubed, like, what do you do when you're buying a camper? And then I show up at this dude's house. I'm kind of kicking the tires and doing this stuff. And the guy's like, so, like, you a big camper? And,
yeah, I love it.
And I was like, no, actually, I was thinking about, like, putting an x-ray in this thing. And he was like, you would have thought, he's like, what? Like, I went off script hard. And, yeah, so then I gutted it to the studs and built out the x-ray room. 2 biggest things we had to solve were, weight and power. X-rays take lots of power, so like that was a whole journey. Because obviously we can't just like go plug into some big old outlet every time you pull up to a factory. And so
from the extension cord,
right?
Yeah,
yeah. So, 220 wire.
Yeah,
it's fine.
Yeah. So again, it was a bit of an adventure, but again, we figured it out. And then the guys at Great Lakes installed it for me, and then we launched that in 23. And the vision was, or the hypothesis was, if we do this, I was gonna at the same time kind of upgrade our software to like the 2.0 version. I had learned a lot working with insurance brokers in that industry, just understanding how the sausage was made and what they needed to see in order to justify investments and different things. And I thought I can streamline my data process, and then I think it'll improve the engagement. When we launched, it's gone much better than I ever would have imagined. It did that and more, and the data that we've been gathering from it is just phenomenal. And so then at this point, we've been partnering with a local manufacturing company to help us build more and blueprint it and patent some of the things that we're doing with it, and I'm really excited about that. But that kind of brings us to today. So we at this point I'm in the process of selling my clinic, and I've just been doing this full time now. I stepped out of practice about 4 years ago, and we after end of 24, I realized, through again that initial model I was describing, where I would go recruit a doctor, I had through every time I'd sell to a business, recruit a new doctor. So we had a couple of dozen doctors that we were working with in Michigan, and I realized we had created a network without really meaning to. So in the sense that, I'm not insurance, but because I had criteria and vetting and training and fee schedules that are cash-based but still a schedule, like this is a network. So then I formalized that network in beginning of 25 and started marketing to doctors. And then I thought like, well, if we can market to the doctors and get them to join preemptively, then maybe I can use that to get more deals done, because I'm just learning more about this industry. And so then we went from a couple of dozen clinics in 24 to now we're over 400. And then it also took us national. So then we went from just Michigan to now we're in just over 30 states. And then we have different product lines. So at this point, sometimes what's confusing for doctors is they think like, oh, like if they've heard of me through a certain product, like we're going to talk about Nomi in a minute. Sometimes they think like, oh, that's what you do. Like you have this thing that you offer. And the reality is, businesses, both from a tax standpoint and benefit standpoint, are complex in the United States. So then you have different strategies that make sense based on the size of a business, the way their benefits are set up, their tax structure, to get the deal done. And so they all function the same for the chiropractors in our network. At the end of the day, I'm negotiating with the employer that they pay for chiropractic for the people, but there's just different way to get that done. So sometimes it's products that I've designed that are strictly cash-based. The company pays me, I pay Kairos, that's how I make money. Or sometimes we've been recruited to be the chiropractic or musculoskeletal solution inside of a bigger product or plan. And then my job is, when that product gets sold by a broker or an agency, to supply the chiropractic benefits and recruit the chiropractors. And so like just on Friday, we got a large deal done in the state of, there's a large benefit group out of Idaho that represents like over 400 employers. And we are going to be embedded in their plan. So anytime that benefit group sells a plan to a employer, then they are buying us essentially. So again, that's kind of some exciting things that are happening. But again, it's just it's been an adventure. It's not, I joke that nowadays, I feel like half of the time I'm like an insurance specialist or tax specialist in something in like this really niche world. But again, it's been a fun journey, and God's moving with it, and I'm doing exactly what I feel like I'm called to do. Because I'll end with this. I'm not going to end, but just we'll give you guys an opportunity to talk more.
No, you're doing great.
Yeah. But what was interesting was the first time I hired an associate doctor was the first time I realized like you're better than me at some of these things. And I've hired multiple doctors at this point in my career. And every one of them I hired, I felt like, man, you're better than me at patient care. Like you're more patient, you're more detail oriented, you're more empathetic. Like there are some things that like I'm really strong in practice with relationships and energy and other things, but like the actual doctor part and art of it, I'm like, sometimes like they're phenomenal. And so then I realized like, okay, so I think what God has called me to do, it's kind of the full circle moment, is when I was young, I struggled with my faith because I thought, I was angry that like, why would God not answer my prayers, that my mom would get better, things would get better, things would change. And now I just think, oh, well, he could see that if he didn't answer a prayer of a little boy when I was young, that it would create this fuel and this vision for who I am today. And, at this point, we're serving tens of thousands of people and who never otherwise would have gotten chiropractic, because over 50% of the employees in our programs were the first experience of chiropractic they've ever had. And so we're reaching people that otherwise wouldn't get care. And I have dozens of stories of people like my mom who were on opiates, who got off or thought they were going to need surgery, who never got one, because chiropractic works. And so then I think what I'm called to do is, there are amazing doctors across the country who are changing lives in their communities every day because they're phenomenal chiropractors. And so I see it's my job to find them and then just give them another platform to serve people, right? I'm really good at this niche thing, creating these relationships, and so that they can find new people to serve and then do what they love to do. So,
Yeah.
So your company, AlignWell,
uh-huh.
pardon me. Now, you've started this for many years now, and how did your partnership with the MAC come about? And then what have you seen that partnership grow into as we've moved forward?
Yeah. So it was hilarious when I met Chris and Lisa. They were, it was funny. Lisa and Chris were giving me crap because they're like, where have you been? Like, where have you, like, how did you, because by the time we met, we were just like working with the hundreds of clinics. They're like, what? Like, what? How did we not know about you? And I was like, well, it's not that I was like trying to hide. It's just like I was head down. And so actually we got connected through Baron Hogue. So Baron, him and I bonded. We kind of see the world the same way. And he, when we met, he's like, I love what you're doing. You should be working with the States. And I was like, well, I'm in Michigan. He's like, you're in Michigan? And I'm like, oh my gosh, like one of my best friends is up there, and like, I'll introduce you. And so when I first met with the MAC, Chris and Lisa were awesome because they helped me to understand just how to work with an association, because up to this point, I would just go to a doc and I'd recruit them, and I didn't really think about ways I could support state associations. And they've helped me to kind of navigate that. And so we started having conversations about what that could look like and ways, because at the end of the day, the MAC's always looking for ways to help their members and bring more value to their members. And that if I'm doing my job, that's what I'm doing. I'm helping them to serve more people, to make a bigger impact, make more money. So it's going to help their members. And so we just started talking about a partnership where we could do that. And then it really became solidified in two ways. One was with a product called Nomi Health. And then the other was with the EMS program. So I'll just start first with Nomi. So Nomi is, I had mentioned before that there are different products or strategies that at this point now we offer to employers, some that I own, some that I'm just a part of. Nomi is an example. I don't own that product. They are a large company, but I am. What Nomi does is they go negotiate cash rates with large hospitals. So they'll go to a U of M and they'll say, hey, we want all the CPT codes that you can offer in all your different outpatient facilities and hospitals, and we want to negotiate discounted cash rates on all of them. And then once they've done that, then they will go shop those rates to employers. I had mentioned when I was speaking yesterday during one of the sessions that in the state of Michigan, the average renewal for health insurance has been 20% year over year for the last 5 years. And so, as you can imagine, most employers cannot afford to double their healthcare costs every 3 years.
Right.
So what that's led to is it's putting pressure on employers to think differently or get creative when it comes to offering health benefits. So Nomi is a competitor to like a Blue Cross Blue Shield or a Priority Health or a United Healthcare. And we don't really have time to get into it today, but I think there's sometimes confusion on what those entities are and what their motives are and what they're trying to do.
Of course.
In our field. But I would say that really, if I'm an employer, what am I buying from a Blue Cross? I'm not buying healthcare. I'm buying risk management, right? I'm trying to pass the buck to them for risk. I'm buying a bunch of doctors that they've said are good in their network and density in an area for my people to use it. And then I'm also buying claims administration, right? Just the handling of everything that's going on. And Nomi, what they're doing is because they're targeting these hospitals, essentially when they come in, let's say I'm your broker, and Ken, you own a manufacturing company in Canton, and Blue Cross is saying, no, you got to pay me another 30% this year. And you're like, well, I literally can't afford that. So then I'm your broker. I'm like, hey, Ken, well, there's this thing called Nomi, and they have contracts with U of M Hospital and Henry Ford. So the way it'll work is I have these discounted rates that I can now offer you, the payer of this plan, that if your employees go to these institutions, you'll get those rates. Now, it's going to be a narrower network because obviously it's going to be a lot smaller than Blue Cross was. But again, you're going to get these cash rates. And so to incentivize your people to steer them to the cheaper providers for you, then, or the more cost effective is probably a better word, then we'll make it no copay, no deductible. So your employees will still have a deductible if they want to go wherever they want. That's fine. But if they want to go and get care for free, then there's a narrow network. So Hudsonville Ice Cream is a client of mine, and when back in end of 24, they made a switch on their health insurance from Priority Health to Nomi. And when they made the switch, they introduced me to Nomi and said, hey, rather than us paying you guys directly, can you just get in network with Nomi, and then that way all of our money's flowing through it? I'm like, sure. I don't know what Nomi is. So then when I met with Nomi, they
Easy as that. No
Yeah.
problem. We'll just
We'll
jump
do
right
it.
in there.
yeah. And then when I met with Nomi and understood what they were doing, I was like, oh, okay. So do you guys really work with chiropractors? Like, not really. I'm like, all right, well, I've got 400.
Would you like to?
We should talk about a deal. And so we started talking, and then the deal I struck was I will recruit your providers for free as long as you give them this no copay, no deductible deal. As long as you make them what they call tier 1 providers, then I'll do it for you. And so effectively what that means is if Nomi's being sold in your area, I can get you in network with them, which is a closed network. So it's not like you can just apply to join. And once you're in, then again, in that example, Ken, if you own the manufacturing company, and
It's a great company.
yeah, it's great. Yeah, they make some really cool stuff.
Thank you.
Miami Vice suits. So
To a T.
Too soon.
No, not too soon. You got to talk about your outfit at
No.
some point. Anyways.
So let's say Jennifer was an employee, and she's like opening her new benefit package, and she's like, okay, well, I used to go anyone in Blue Cross. Now I have this Nomi thing. So she gets an app. She opens the app to see who are the tier 1 providers, meaning the ones, again, that she can go to for no copay. And then I own a chiropractic clinic in Canton, and I'm in the Nomi network through AlignWell. So then my clinic shows up. So in the chiropractic tab, I'm there. So then she calls the clinic, and then she's going to bring her Nomi card in, and then that's how we're going to know, oh, sweet, so your employer's going to pay for this care. And then, they're a new patient, but it's an amazing thing. So the reason I bring this all up is normally, like when I'm doing cash-based programming for employers, the billing is incredibly simple because it's cash-based, and my team handles all of the billing. The providers are just submitting basic receipts to us. We pay them direct deposit. Nomi, because they wanted us to join, get in their infrastructure, and then work with hospitals. Hospitals are used to medical billing, and so they use these, administrative outfits to run claims through. And when I started looking into it, I'm like, oh, this is like true medical billing, and I don't want to be a medical billing company. So I called the MAC and said, hey, can I talk about, I have an idea for our partnership. Can I connect with Michigan and now Chiro Edge? And I was like, can we talk, because I would love to work with them, and so they can handle billing for these offices I'm recruiting. And that was how it first started. The second way it started was with the EMS program. So the MAC started telling me about how they had received some initial funds from the Michigan Association of Ambulatory Services to help first responders. First responders are 7 times higher likelihood of having spine-related injuries than an average worker. And so the workman's comp plan, representing the EMS and paramedic crews in the state of Michigan, basically gave a little bit of money to the MAC and said, hey, can you guys put together a program or something to help us? And the MAC was working on it for about a year, and they were, testing some thoughts, but they just didn't have clarity on what to do. So then they, asked me, could you look into this? Could you talk to the broker and see if you have any ideas? So I met with the lead broker who was running the program, and I think has been a long-time friend of the MAC. And when I started asking him, what do you need to see for this to be successful? What are you looking for? And I realized, I'm like, oh, this is what I do every day. I work with brokers and agencies all day long, and so it was right in my wheelhouse. And I said, oh, okay, well, yeah, that's what I do for employers all the time. I designed a plan and a program, and I presented it back to the broker. I said, this is what it would look like. This is what we would do. This is the budget we would need. And I said, like, it's going to be more than the initial seed money that you have brought in. And then the MAC suggested that I approach because normally, again, up to this point in my life, I've always just gone to employers. They pay me directly for this stuff. So I'm used to negotiating deals with these employer groups and having to tell the story of ROI and everything else. And so I just assumed that we would approach the hospital in Port Huron, Tri-Hospital, to pay for the rest. And but the MAC said, we have the Michigan Chiropractic Foundation that I think you should talk to. This might be something that they'd be open to funding. And so met with the MCF a couple of times, again, kind of showed them the vision. Again, what the program is initially, I think what the MAAS was thinking was, oh, we'll seed some money, give it to the MAC, and then the MAC can help us to create some like traditional wellness programming, or like whether it be videos or workshops and et cetera. And in my experience, especially for what they were looking to achieve in lowering risk of these injuries, I had told the broker, I'm like, that's probably not going to move the needle enough for what you're looking for. Like, you're telling me you want an apple and then you're giving me money to buy an orange, and like, this isn't going to be good. But we can get you an apple. It's just going to cost you a little bit more money.
Apples are expensive.
They are expensive, especially those Honey Crisps. And so what I told him was, we need to get these folks under care. Like it can't just be education. They need to be building relationships with providers. Those providers can then deliver the care, do what chiropractic does. Like, you can't, as good as we are at our profession, if we can't get our hands on people, we can't really help them. Like, we need to do that and build relationships and trust and all that stuff. And so I said, if we can do that, then, and like, we can still do some education pieces, and we do both, then I'll get you there. And so that's what I pitched to the MCF. I said, I need the shortfall, and what I'm looking to do is I want to pay chiropractors in the Port Huron area to take care of these folks. We'll bring the mobile unit, we'll do these initial exams, and then we'll send the patients to these local clinics, send the x-rays over, and then they're their patients, and then we'll pay for the first 10 adjustments to get them started. And then that way, the goal is, more than likely, there will be some folks who probably need more than 10 adjustments. I'm not denying that. But the goal would be that by the end of the 10, they've had some relief, they built some trust, and then the chiropractor can certainly close them for additional care and services at that point. And so that's the program that we're launching. And so, to answer your question, the partnership grew organically. It was initially, we had these conversations and with Chris and Lisa, and it was we were just trying to figure out, like, I wanted to support the MAC. I just wasn't sure exactly how, and they were wanting to support me. And then I had these two opportunities that came across, and I was like, guys, I'd love to work together on these things and partner with them. And so it's been awesome. I'm really excited about it, and really excited to see where both of them go. If you're listening to this and you're a chiropractor in Michigan, you should talk to me, because at minimum, Nomi Health is one where you should participate. I mean, it's growing exceptionally well. It has in West Michigan and Mid-Michigan. They just got a deal done with Henry Ford Health and to get into the Detroit market here. So in this renewal cycle that's going to be happening in 2026 and early 27, there's going to be a lot of employers that are going to move over to Nomi, which means you might have patients who you're already taking care of who, if their employer switches to Nomi, now they can just get some of their care covered at 100%. Again, it's an amazing thing, and it's an exclusive thing, so you'd be foolish not to. And then on the EMS side, I've also started talking to the City of Holland for their police and fire. And we're going to be doing some things with them this summer. And so originally we were just going to do the pilot alone in Port Huron. We're bringing the mobile unit there on May 12th and 13th. But I also was able to talk to the City of Holland and kind of see what ways that we could expand that. And so through Dr. Markle, we're going to also plant some seeds with Bay City Fire, and then through Blue Squires, we're going to be connecting with Ludington EMS. So the appetite's there. I mean, what's been really cool to see is that the community in the first responder community, they're looking for these solutions. They're looking for, just like these other employers I'm working with, they're looking for a different way to go about it. They just don't know what's out there. They don't know what's possible. They don't know how to fund it, how to operationalize it. Because I think the two biggest barriers that the Lisa, when I first met her, she was saying, like, oh my gosh, you figured it out. And, like, chiropractors have been talking this for so long. I was like, yeah, you're right. I think chiropractors for a very long time have thought to themselves, like, when they were driving home, they'd pass a business and think, like, that business should pay me to adjust their people. Like, I can help them with absenteeism and productivity and, like, all these things. And all these assertions that I would argue are fundamentally true,
Right.
but we haven't had the data to support it. And then we also, I think the other thing, too, when I first started, like when I started AlignWell, I at first I thought, like, I'm just going to try to find someone who's doing this and then maybe work with them or partner with them. And I literally asked everyone I knew in the field, all these prominent names, then people that we probably all know here. And for, like, do you know anybody? Do you know anybody? And I would get these one-offs where there'd be like, oh, I know this chiropractor who he's got to deal with a business or blah, blah. And I'd call him up and they would be like, yeah, I've got this one, but nobody have kind of figured out how do we operationalize this? Because I think what I heard more of was sometimes there would be a chiropractor who he or she was able to, like, get in a relationship with a local business. Maybe they're a patient, they're a friend, or whatever, and then it would lose steam because the chiropractor gets busy or something else is going on. And I think as chiropractors, sometimes we just think, like, oh, if we can just get the business to say yes and give me money, then everybody's going to use me. It's going to be amazing, right? Because it's just money. Clearly, that's just the problem. But the reality is that the harder part of my world is the operations, because if I'm selling to an employer and I'm selling this vision, and even though I have the data now to back it, it's still like I then have to walk the walk. Because if I pitch them and they say yes to this program, and then I can't get engagement, I can't get people to use it, and it's not working, then, like, anything I promise them is not going to happen. And so that's the harder part is there's two sales in this world, and the first one is the employer, which is already difficult and fraught with it's just tenuous. But then even if you get them to say yes, what's even harder is the second sale, which is if they've got 100 employees, now you got 100 sales, and you need to get them to, like, buy into what you're doing and actually use your product, actually work with your chiropractors, actually do these things. And that is a whole other bear. And so I think that's the thing that, again, we've kind of hung our hat on. And what I'm excited about as we continue to expand with these different municipalities.
What has worked? Say you get in with an employer. What has worked once you're in with the employer to get the employees to buy in, as you said?
Yeah, I think it's a lot of really small intentional steps. It's like not because again, at this point we do both on-site and near-site care. So when I had opened earlier, I was talking about how we do the on-site,
camper.
Yeah, the camper. And so we bring the mobile unit there, to an employer once a year. Initially, we do all the new patient exams, and then again, we'd have a chiropractor coming on site and doing their adjustments, usually weekly. And then we come back once a year to do reevaluations, and also new patients, new employees. And so then, that I love those because then we get to see these amazing transformations, and, like, that's one of the favorite parts of my job. But that's sometimes people are like, oh, you bring the camper there every week? No. Like the camper's just there to do the exams. But the other thing is, again, we do near-site care now, meaning sometimes we're just creating a relationship between a business and a local chiropractor, and then the employees just go to the chiropractor's office. So Nomi's a great example where they're just going to come to you, and usually they're going to be doing their new patient exam with you and doing that. Sometimes Nomi groups will have us come on with a mobile unit and then refer them to a local clinic, just like we're doing with the EMS, where we're bringing the mobile unit to do the exams and then referring these folks to the local chiro. But either way, whether you're doing on-site or near-site care, you just got to there's a lot of steps stakeholders that have to be bought in first and foremost to even get the employees bought in. Like inside of organizations, you have teams of people and managers and influencers and people that are like influencing the zeitgeist inside and culture inside of a business. And so if they're not believing in what you're doing, then you're going to be pushing a stone up the hill. And then so then once you get them bought in, then you need to again be able to communicate effectively and efficiently with the rest of the staff to get them excited. And you need to be able to position it as like, why does this matter to them and why should they? Make it again something that is, you just have to understand. It's a lot of psychology. It's like understanding who you're dealing with, what are their motives, and what are they looking to achieve. How can you position yourself as a guide or solution to get them there? I think is the thing that some chiropractors just mistake, because there's a burden to knowledge, meaning like there are things that in chiropractic that I think it becomes so intuitive to us because it's like, yeah, it's common sense. Like, yeah, of course, everybody knows that, like, this is good for them, whether, in different pieces of the three-legged stool or whatever. And it's like, no, that's revelational to other people. And so you have to be able to truly understand who you're serving really well. And then, again, how can you show them that chiropractic is an amazing tool to get them the thing that they're looking for? And if you can do that, then you can move mountains. So.
It's amazing.
I love that. Have you had any challenges going into different states? Some states have different laws or anything of that nature.
It's just the nod.
I think the look says
That's
it all
it.
right there. Yeah.
Yeah. So early on, as as I was starting off in this venture, and like when we started, it looked like there was legs, like it was working. I spent a lot of time talking to Stu Hoffman, so I use ChiroSecure for my malpractice, and Stu's become a good friend. And so I'd have lots of calls with Stu, and also I spent a lot of time talking to healthcare attorneys, just understanding, again, like,
Sounds fun.
Yeah.
oh gosh, man.
Riveting.
Yeah. Again, that's why I joke. I'm like, I've become such this like niche expert in this really niche world, but it's yes, the short answer is there's been some complications. Some states are more difficult than others. There are some products that we sell or we don't sell in certain states, or we're still trying to figure out like what it's going to look like to scale in different states. Thankfully, Michigan has been, in some parts of Michigan, like things are a lot more strict and hard, and then there's other things that are really nice. And so I think every state has those nuances. And then also what's fascinating is what's happening also from an employer benefit side can sometimes vary dramatically per state, and there are very different types of benefits and benefit strategies. And so then there are some states that are like still doing things that are very like old school, or kind of like being like in the Michigan market would be seen as like that. It's like we did that 10 years ago. And so then there are some states that are just a little bit behind the times. And so then creative ideas like this direct contracting stuff I'm describing is new to them. And then you have other states that are really progressive. And so even in the business market sometimes so there's been both sales difficulties at times with that, and then also the kind of legality or legislative side that can sometimes be really complicated going across state lines. And even with the mobile units, again, when we contracted with a local company in Holland to help us build more, and then going through the processes of like patent law and other things, it was like, oh wow, there's some different regulations around like towing and weight and radiation. And I mean, radiation I knew, but then there were other things where I was like, oh, I had no idea that like I was going to have these different things in place from a legality standpoint to drive across state lines. So anyways, yes, short answer. Yeah.
Do you see any limits you said you have 400 chiropractors in Michigan now. Do you see any limits to how large this could grow?
So I would say this, sometimes, Ken and I, when we first met, we kind of bonded over, just the chiropractors are a unique bunch, or we are a unique bunch. And I would say that what makes us incredibly strong and unique is also one of our biggest weaknesses, in the sense that we are incredibly passionate and also independent, like fiercely independent. And And so then what that's led to is if you ask 1,000 chiropractors what chiropractic is, you're going to get 1,000 answers. And then we're pissed off when the insurance industry or the medical industry or the general population at large doesn't understand what we do. It doesn't value us. It's like, well, we can't even coherently say what we do. And so it's no wonder that they're confused and they don't understand where to put us, how to value us, and otherwise. So what I'm excited about, though, is that the biggest payers into the healthcare system are employers. They pay the bulk of the premiums that fund everything in healthcare, and then they also fund the majority of the taxes that fund Medicare and Medicaid. So the up to this point, there's been a lot of political efforts in chiropractic on legislative change, both from a state and national level, and then also, like Ken knows this incredibly well, with insurance companies and like trying and working with the payers and trying to push for things. And those are needed and good. But where I see things moving like the fastest and where we're going to have, I think, as a profession, the best chance to capture momentum is because those efforts are needed but often slow and tenuous, is with employers. Because, again, the pressure on employers is immense. Like I was saying, it's becoming unsustainable. Employers cannot continue to just write a check for 20% more every year. So then they're having to get creative, and they're looking for solutions. And they're becoming much more agnostic. Like, if you can't afford your healthcare costs, your like biases or your preconceived notions or anything else starts to quickly go away when you're just like, I just need to save money. I just need I just need to be able to get this done so I can go back to running my business. And so I'm finding that it's becoming easier as I'm talking to these big benefit organizations that are just they're kind of agnostic to the solution. They just need the solution.
Right.
And so we have an opportunity as a profession to step up into that. And so to answer your question, I would say that kind of the big vision, what I was hoping for is that, like I mentioned when I told my story, my passion around the opiate crisis, and musculoskeletal spend is in the top 4 most employers in the United States as far as what they're spending their dollars on. It's the leading cause of disability in the world is spine-related injuries. And so it's driving a lot of cost and pain. And then opiates, there's about 50% of the folks who died of opiate overdose last year started taking their opiates for musculoskeletal conditions, and about 3/4 attributed their injuries to work. And so there's a lot of people. And I have this vision that, if we can get 10,000 clinics to can create at least one relationship with a local business of some kind, where their people are getting better access to care, then we'd be serving over 1 million people a week. And that would be a strong leading indicator to make a dent into the opiate crisis. Because if we could be the solution when the injury happens, or even better, prevent the injury from ever happening, then that really starts to make a big dent. And again, like the example I gave then on Friday with this big agency, the deal we were able to get done, that's going to continue. So I came to this conference obviously to speak and to support the MAC. And I'll be going to Cairo Congress in November, but I'm not going to many Cairo conferences at the moment over the next few years. I'm spending almost all my time going to very large benefit conferences, talking to, that's where and actually my mentor, who I met last year, is someone who's tied like into all these benefit people. And he's been introducing me to these large agencies and people that are like the plan administrators for thousands of employers, and hundreds of thousands of Americans. And he's just been helping me to see, like, you're delivering a lot of value in what you're doing. Chiropractic's working. So let me introduce you to these people that instead of selling, like I started in one business to another, I'm going to get you in the room with people that in one sale, you'll sell to 400 businesses. And that, again, is where I'm really excited, and where the puck is going is, again, a lot of these groups are becoming agnostic to the solution. They just need a solution. And so I think sometimes we're our own worst enemy in chiropractic, because sometimes we think, like, when we hit resistance, it's because, it's like we're insecure about, like, oh, well, they don't believe in chiropractic, or they have these, these old biases that I'm not saying they don't exist still, But I think sometimes that's our own insecurities, and the reality is they may not just know us or understand us or really think about it. And so if they knew truly what we were doing
the value.
and the value, then I think they would be much more willing to have the conversation than I think you realize. And that's what I'm seeing more, is that they're a bit agnostic to it, which is exciting. So that's kind of the big vision. I hope we can, it's not even a hope at this point. It's like it's working.
Yeah.
And so it's like it's happening, and it's exciting times. I'm also excited too that private equity hasn't really been able to get a big foothold in our profession. We're still 90+% independently owned, which makes my job sometimes a lot harder because I have to go recruit doctors one by one. But it also leaves that independence that makes it sometimes easier to do some things. And so there's pros and cons to the independence. But I'm excited that there are still a lot of offices that are independent, that are finding ways to stay successful in practice. And again, what I'm doing is not replacing your marketing flywheel or anything you're doing. It's just adding another quiver into, or arrow into your quiver. And that's, again, what my whole pitch is to docs is, I'm not a marketing agency. It's like, hey, I'm going to bring you 30 new patients this month. But what I can do is if I can get you 1 or 2 contracts a year, that compounds into like some really awesome steady business over time that can be a really nice thing to add some stability to a clinic. And that's, again, kind of our goal, is like, this is more about the long game and creating these big, long lasting relationships for your brand and your community, as opposed to like kind of quick hit, like, the thing that I think we're sold a lot in chiropractic of, but anyways.
So how do chiropractors, how do they get in contact with you? How do they get enrolled in this? Where do they go?
Yeah, good question. So if you go to AlignWellCertified.com, you have our website there. I had mentioned before, but again, the way that we structure our fees is I make money when chiropractors make money. So we have a one-time credentialing fee, but it's like literally just our cost for our hours, and I think it's like right now, as of now, I think $150 or something. Like it's nothing.
Cheap.
And the reason why we do that is because, again, chiropractors getting squeezed from a lot of areas. I don't need to add like some big thing. I'll make my money when we get deals, and so when you'll see on the webpage, but basically there's a questionnaire. There are things that we look for in a clinic to work with us. As long as you meet those things, then we'll approve you. And then you submit licensing, and again, there are things that you need to make sure, like we have some things that I think are basic, but they still are some due diligence things on our end. But again, it's a kind of an admin process. You go through it, you pay the one-time fee, and then you're in. And then we start to either plug you into products that are live in your market, or we'll help you to kind of get some sales going. And yeah, then I'll also put in the show notes. There's a phone line that they can text as well. I can't remember it off the top of my head, but I'll make sure that's in the show notes.
We'll get it in a link in the comments or something.
Yep. So they can just text Mac to that number, and we'll get that too. So
fantastic. I am so happy and impressed with everything you've done so far, and we both look forward to seeing this grow and blossom into benefiting the world of chiropractic in any way, shape, or form. And you are definitely carrying the torch, and we very, very much appreciate your time, your efforts, and we look forward to having you on in a year from now to check back in and seeing where all this is gone.
Yeah, I really appreciate you guys, and again, I'm an open book. I'll also just include like my email and like my personal contact information. I'm very knowledgeable and passionate about this really niche thing. But if I can help anyone, any member in any way I can, I'm here. I live here. Again, I'm in the process of selling my practice, but my wife and I live in Holland. We got 3 kids. Like, I'm from Jackson, from the state. It's where I'm here to help.
You're a Michigander.
I'm a Michigander.
Home.
Well, thank you so much. We really appreciate it. And thank you all for tuning in to another episode of Aligned and Uncensored. We will see you next time.